So, but yeah, no, I thought they had a great grasp of what we were doing, and their previous healthcare experience working with other organizations was obvious. They're working with other FQHCs. Just for example, their understanding of what the reading level is of a standard patient was huge. It was like, oh, in fact, we didn't know. So the native digital staff informed us what the reading level was of our own patients. So that was, beneficial for sure.
Yeah.
But I think the thing that I appreciated as much as anything else about the creative aspect of the project is that it never once felt like that the team at Native was trying to give us the same solution they gave anybody else. It felt like it was very informed about our needs, our business problem, our business opportunity rather. And so it was tailored to us. And I felt like this is, so it was personalized, it was, it's what you would think when you hire out an agency of their caliber. But sometimes you just don't get, you get what they've done and it's worked for everybody else. And so it should work for you, but that's not what we got. It's not what I felt like we got anyway. So from a creative standpoint, just as an agency, they brought their creativity, not just to the design, but to the holistic end-to-end solution, and so those were the things that I thought were really significant about our process. And one of the things that I appreciated a lot about working with Native is a third element that they started the conversations with that really demonstrated their business savvy. And I don't care how great the creative is. Great creative is only great if it solves a business problem or if it capitalizes on a business opportunity. And so the entire strategy at Native was based on, this is a business decision. This isn't, we're not in love with creative just because creative's cool, although it is. But if creative doesn't accomplish specific objectives, then it hasn't helped anybody. And so, Justin and the team there really clearly understand that. And so they help ask a lot of questions to get to like the root objectives of what the campaign's about. And I really appreciated that for sure. Homeroom Health itself as a business model exceeded year one expectations. Specifically, we had planned certain levels of performance for the number of patients and the number of visits, and we surpassed both of those numbers, which is exactly what you want. When your board of directors takes a risk to open a new location, doing something different, and for our team to exceed both of the primary measurables, that's a huge success. And so we were really gratified as an organization about that.
That's awesome. So last question.
Yeah.
What was the thing you liked least about working with Native? And you can be honest.
Thing I liked least about working with Native. The thing I like least about working with Native is that I don't get to work with them as much as I'd like. Right? I wish we had a bigger budget to do more project with them, do more projects. That's kind of a complimentary answer. It's not really what you're looking for, but honestly, it's
I don't mind it though.
Yeah, I don't mind, of course. Yeah. So tell Justin you're welcome.
Right.
Right. So it's going to be a good soundbite.